One quick note that I'd like to make before I turn it over to Val. If you haven't noticed, in the chat box, I did make mention that we have January through March 2021 webinars posted now, so you can register for those anytime you would like. They are on the division's upcoming webinar page, as well as the COVID webpage down at the bottom under that last accordion. And with that, it is all you, Val.
All right. Good morning, everyone, and thank you, Heike. I'm talking into my phone, but I'm trying to look at my camera. So if you can't hear me drop, I know you'll drop it in the chat. I rely on that. So wanted to just start first with, we've had many losses to our DD world this week. We have losses every week. But this week we lost two really great advocates, and I know we've lost more people than this, but I know the loss of Bill Knittig with Jefferson County DD Advocates, and then also the loss of Michelle Hofmeister. She was a member of the DD Council. She was a member of the St. Francis County Senate Bill 40 Board. She worked for the Department of Corrections, where she had spent a career really advocating on behalf of people with mental illness and developmental disabilities in the correctional system. So those are tough losses, and they're tough losses for the system. They're tough losses for all the folks that have worked with them over the years, and they're tough losses for the individuals that they have supported across time and their families. So just didn't want to go through this call without bringing that up, because it is a stark reminder that COVID is here. It's very real. We all know that, and we feel it every day. With that, we will not be right now. We're not planning on having, this is going to be our last COVID webinar for the year, or whatever we're calling this webinar, I'm not sure, for the year. We have, we would be having it on New Year's Day, and I don't think I get a lot of participation on New Year's Day. So if we need to push stuff out, we will be using and anything we would need to push out between now and next year would be around the vaccination. We've got lots of channels to push that information out. If we feel like we need to have an emergency session, we can also schedule one of those. But right as of now, it is not the plan to do any more of these for the rest of this year, and we'll start again next year, and Heike pointed out how to register for January through March. So we're not going off the air, we're just going off the air for a couple of weeks. We'll still be back. And then we'll have the legislature will be in session, there'll be budget, there'll be lots of other reasons, hopefully, to listen. We could talk about the number of COVID vaccinations that have occurred, and I know that's on the list of things to talk about today. Before I get to that, though, want to give you an update overall about what we're seeing among our DMHDD community COVID-19 cases for the individuals we support. We are up to 1,342 positive individuals that we support. We have had 9 new cases today. The number of new cases this week per day has been down quite a bit compared to what we had been seeing. It's nice not to see new cases in double digits. I prefer to see 0, but we know that's not very likely right now. We did have another death today. We're at 39 total deaths for individuals in the community, which makes our mortality case fatality ratio higher than average, what we're seeing for the average Missourian, and we know that. We also have 233 providers that have been active by COVID, and we keep adding new providers almost every day. So new providers are impacted by COVID every day in our system. With that, we have a testing update. So we do continue to cover testing costs now through the end of December 30th. At this point, not sure what that will look like in the new year. So we will need invoices in by January 10th for anybody who is actively using testing in the community. The need for testing will probably change based on who's been vaccinated and who has not been vaccinated. We don't have that all figured out yet, so I don't want you to think it's not something we're not talking about. It is, but our really primary concern right now is to get people access to vaccinations. Before I go into vaccinations, I do want to just give a final update on the CARES Act funding that the division pushed out to both day have employment, ISL, and group home providers. So we initially started with $20 million to push out the door. We got $14.6 million of that processed by December 1st, which was our date to get things done. At that point in time, we were allowed to reallocate what had not been spent yet, that $5.6 million, and we were able to push out another $3.9 million of that. Then fast forward to December 7th, I think, and we were notified that we had another $2.4 million allocation for day habit employment providers. Of that $2.4 million, we spent $2,399,277.20. We had one provider who chose not to attend. So that was really, really good, and we're happy to push that money out. Right now at the federal level, I mean, what we're hearing is that any stimulus bill that passes this time, and remember there's multiple stimulus bills out there, but any stimulus bill that passes this time is not going to have any funding, additional funding in it for state and local government. So that's what we know now, but that is likely to change. And if you follow any of the federal spending stuff going on right now, you'll understand that what you read at 8 o'clock in the morning is different at 2 o'clock in the afternoon. So we will keep you as updated as we can on what's going on at the federal level with federal stimulus funding for all of us. Now let's go on to vaccinations. Heike, can you pull up that sheet for us first? We got a lot of questions this week about, we'll go to that next. We got a lot of questions this week about, I'm going to have to pull it up on my screen because that is tiny. Hold on one second, folks. I'll try to talk while I'm doing this. We got a lot of questions this week about vaccine distribution. We continue to get lots of questions about, really how do I make sure I'm on the list to get vaccinations first? And I want to show you, there's some stuff on this sheet I want to specifically speak to, but I'm going to try to pull it up first so I can see it better. Nope. I got to find it. Here it is. Got it. Thank you for being patient with me. I should have pulled it up. I didn't realize I was going to have that. I don't want to, since I have the video on today, I don't want to get super close to the camera. That's scary for everybody. Okay, so the sheet that Heike is showing right now is talking specifically about the vaccination. The top is what we know about the vaccine. We know the safetiness of it, the efficacy of it, the 2 doses, the stuff in that top box. I think everybody on this call should be relatively familiar with. We have talked about that a lot. There is information about minimum orders of vaccines there. So this is for folks that are the vaccinator. If they're ordering the Pfizer vaccine, it's a minimum order of 975. If they're ordering the Moderna vaccine, it's a minimum order of 100. And part of the reason that is the case is because of the storage temperature issues. So we know the Pfizer has to be kept at ultra cold, and the Moderna can just be kept in like a regular refrigerator. So that's part of the reason why the Pfizer, it has to be shipped differently with dry ice, and that's why they require a larger order. So a lot of what we are going to be seeing in Missouri for our folks is probably going to be the Moderna vaccination. Just keep that in mind. That's at least what we're hearing a lot of at this point. Everything I have is anecdotal. I know everybody wants to see things in black and white just like this. It's so fluid. This is what we've got right now, okay? So I need you just to understand that. But we are constantly at the table trying to represent what our needs are, and we're hearing good things in the community about folks being able to access vaccinations. So there is something called the Federal Pharmacy Partnership for Long-Term Care Programs out there, and I know a lot of we get a little lost in the words here, but this really applies to congregate care settings of folks serving people in long-term care type populations or situations. So I know we have a lot of folks that were able to access the vaccine through this program, and those folks could probably likely start seeing vaccinations the week of December 28th. For our state ICF facilities, I know we have been contacted at 2 locations, and we've got 1 vaccination date set right now for December 28th. For the Moderna, both locations, it's the Moderna vaccination. Also, just some information, insight on that process. We are required to fill out a vaccination record, and a part of that before we can get the vaccination administered by person. And part of that vaccination record includes a consent that has to be signed. So yes, we will actually, there's a question in the chat about this vaccine fact sheet available online. I'm pretty sure it is, but we'll also send it out too. I mean, this was supposed to be, this was available to go out for large, and we'll go to the website also to look at that too. So this is available for large distribution. The next thing I want to talk about is, if you'll scroll down, Heike, to the populations part, because I know we're getting a lot of information or questions around the population. Actually, let's look at that potential timeline first. So that's a good place to stop, Heike. Missouri's COVID plan consists of 3 phases: phase 1, phase 2, phase 3. And so phase 1, the goal is to reduce the morbidity and mortality of the COVID-19 within Missouri while reducing healthcare system stress. And remember, we have minimal doses coming to the state, and in December of 2020, and slightly increasing through early of 2021. So we have to pick and choose who gets the vaccination, and we have talked about that up front. So if you look down in that phase 1A, you are going to see long-term care staff, that's skilled nursing facilities, RCF, ICF, ALS. Those are the first population. Paid and unpaid facing healthcare workers with comorbidities, that's going to be we fall into that category. A lot of our employees fall into that category, plus all of our hospitals fall into that category. Anybody else remaining patient-facing healthcare workers. And again, patient-facing healthcare worker means that you are doing something with those activities in daily life that are going to require you to probably be a little bit more intimately involved in someone's life. And you guys know what that means. So I'm not going to spend any more time on that. I know you want us to be able to stretch it as far as we can, and I always tell people it doesn't hurt to try. What can they do but tell you no? And so that's what you need to be doing. If you've got questions, I know we got a question in the chat already. Will they have programs still be the first tier of vaccinations? And it was originally mentioned, but now the focus seems to be on long-term care facilities and ISLs and group homes. So again, you can see, yeah, I think you will be, because if you're doing patient-facing healthcare work, yes, but it is going to these other places first. So just because you haven't heard anything yet doesn't mean you won't hear something. To give you an idea, we actually just heard on Tuesday that we had to have our vaccination information to Walgreens by Friday of this week. So it will move quickly when it moves. So please be paying attention to emails, phone calls, and responding, because you will have to move relatively quickly. So the estimated population over there on the right, that's the number of people they estimate to be in these categories. We're seeing on the staff side, based just off of the anecdotal surveys across the system, between 30 and 60% of staff are comfortable already getting the vaccination. We also know that, yes, and we've talked about this several times, we believe DSPs do fall under 1A, and we've said that many, many, many times. They are patient-centered, patient-facing healthcare workers. So, but it is going to be there is no way for them to get a vaccine in the 1A category without going through the provider. So if you're a provider, it is your responsibility to access this for your employees, for the folks that you support. So I want to make sure that is very, very clear. Next, we have, that's the list in phase 1A. Phase 1B, individuals that are 65 years or older. And when we move as a state to phase 1B, what we're hearing right now is that for the most part, individuals aged 65 years or older are likely going to be able, if they haven't got a vaccination in phase 1A, probably just going to be able to go to local pharmacies that are allowed to administer the vaccine, walk in, prove their age, get access to the vaccine. Same for high-risk individuals 18 to 64. Likely going to be something you get from a doctor that you then take to the pharmacy to get access to the vaccine. We don't fully understand that yet, so there was a question in the chat about who do the minimum order numbers apply to. Those are the vaccinators. So you have to either be registered as a vaccinator for those minimum order to apply to you, or you have to be working with a pharmacy who is or another provider, because the FQHCs are also enrolling as vaccinators. Anybody who's enrolling as a vaccinator, that's who the minimum order would apply to. So then, and you can see high-risk individuals, first responders, essential employees with high-risk categories. That's going to be people like jails, essential employees, child care, schools, energy. So that's the difference between phase 1A and phase 1B. I will tell you that we have a lot of individuals with developmental disabilities, intellectual and developmental disabilities out there that are not going to fall into that high-risk category of 18 to 64. that are also not living in any sort of congregate living environment, and that's okay. They will fall into later categories. But remember, we have limited supply, and we have a lot of people in the pipeline to get the vaccination. So I wanted to just put that out there again. The next thing I wanted to talk about, because there has been a couple of articles yesterday and today about the access to the vaccine that's going to be coming to the state of Missouri. And I know a couple of weeks ago, we reported to you all that the state of Missouri, the week of December 14th through the 20th, would be getting 51,675 doses of the Pfizer vaccine. We did get 51,675 doses of the Pfizer vaccine. For next week, December 21st through December 27th, we had originally estimated that we would be getting 63,000 doses of the Pfizer vaccine and 105,000 doses of the Moderna vaccine. We have now changed that, and our new estimate for the Pfizer vaccine is 37,000, so we're down 26,000 doses there. And of the Moderna vaccine, new estimate has not changed. It's still at 105,000. So if you look at these populations, 70,000 staff in long-term care facilities, 102,000 paid and unpaid patient-facing healthcare workers, 250,000 remaining patient-facing healthcare workers. You look at those numbers and you look at the number of doses of vaccines that we are getting into the state, you can see that it is going to take a while to get through that phase 1A category before we even get to the early tiers of the phase 1B, okay? The week of December 28th through January 3rd, we had estimated to be getting 76,000 doses of the Pfizer vaccine and 46,000 doses of Moderna. Both of those have been lowered. We're now getting 37,000 doses of the Pfizer, which is a decrease of 39,000, and 37,000 doses of the Moderna, which is a decrease of a little over 9,000. So, not sure why that change has happened. We're still looking into that. There's lots of speculation on the internet, but I want to make sure, I don't care, I mean, I pay attention to that, but I want to make sure you know these numbers and these numbers on population so you have a better understanding of where we stand. Now, Heike, because I know I just saw in the chat, perfect timing, thank you. I have two mouses going here. Okay, Val, can you clarify what I think I heard? Did you say the TCMs are eligible for phase 1 vaccine? I actually don't believe the TCMs are eligible for phase 1 vaccine. I do not consider you to be patient-facing healthcare workers. I feel like you're probably more in phase 1B, essential employees with high-risk essential employees. I don't feel like you're a phase 1A group, though, but definitely I think you would fall into phase 1. Now, that is going to be, you need to register. If you want to get vaccine in phase 1 or 1B as a provider, you're going to need to register. And I know we're going to have Tim come on next to kind of talk through that. Let me go back up in the questions and see if I missed anything. Okay, good. I think we're caught up there. So I know another thing that we're getting, how do they determine what is high risk? That is a determination that happens at that pharmacy level. You're going to answer questions. They're going to say you're high risk. But all those categories that CDC has listed historically about people that we think are at high risk of COVID, diabetes, asthma, those type of conditions are the conditions that they're going to be looking at for high risk. Okay, Heike, can you go to the website, please? We've sent this to you guys. We've gone through this website with you all before. We're going to put it back in the chat. We're going to go through it again with you. There are lots of questions around the vaccine and a lot of myths out there. And so this website was put together to help people understand all of the different questions you're asking in the chat right now. And I highly recommend you go to it and look around. There's information for residents about, are you ready to get vaccinated? When we think, we can't tell you what day vaccines are going to be here. I mean, that's as good as what I just gave to you, is as close as we can get, but we just can't tell you that. There's information for people who want to be vaccinators, and then I love Get the Facts. So, Heike, could you please go to Get the Facts? Okay, and then scroll down a little bit. There's a section there called Rumor Control. Oh, go up. I'm sorry. Yeah, there we go. So there's lots of questions in here that can help you. If you read through this, that will help you get answers on the vaccination. This is also updated regularly. So please, please, please take time to look through this and get as much information as you can about the vaccination. I know, can you confirm that facing healthcare workers will only be, okay. I can't confirm anything about the vaccination, and I'm trying to drive that point home over and over and over again. Even this black and white sheet that I've shown you is constantly changing. The number of vaccinations that are coming into the state is constantly changing. You got to be scrappy. This is a very fluid process. So the question was, can you confirm that patient-facing healthcare workers will only be able to receive the vaccine in phase 1A if their employer is a provider? I think your best bet to get the vaccine in phase 1A is if your employer is a provider and they are working on securing it for you. That is 100% what I believe. How that rolls out in February, I am not sure. So I just wanted to make sure that we shared that. I joined late, and this is the first meeting I've attended. Do ISL sites fall in the 1A category? Yes, we do believe that ISL sites fall into the 1A category. But as a provider, you will need to find a vaccination partner to make sure that you can get your employees and the individuals you support vaccinated. Okay, so back to the website. Thank you, Heike. But there's rumor control on here. There's all sorts of stuff. We actually, just on the fusion cell, we did a whole exercise with 150 different state employees that follow the fusion cell that listen to this stuff regularly, and we just had them throw into the chat. I don't want you to do this, but you could if you wanted. All the different things that we're hearing out there about the vaccine and its effectiveness and does it work and does it not work and what scares people about the vaccine, just throwing those in the chat. And it was really good because it was great. The person that put together this Show Me Vax website said, all of that is answered in the Show Me Vax website. So there's nothing that's been thrown out there that's not been answered in this. Is there any videos to show employees about the vaccine? We're all working on those, and I will tell you at the department this week, Dr. Stanislaus did an interview on the vaccination that we're going to share with our employees. So whenever that is done, we will share that with everybody. Also, we're doing another kind of brief video on why we're getting vaccinated, why we think it's important. I think it's important because it's my responsibility to do it as a citizen, and it's an easy way to help. So is there anything we should be doing at the state level to help ensure that we have vaccines for our residents and staff? Okay. You know, I know a lot of people want to do advocacy. I feel like our voice is heard. I'm not feeling like, I feel like the frustration right now is more around the fact that there's so limited doses and so many people in that 1A category, and no one knows where they fall, when someone's going to call them. I can tell you we feel the exact same way with the state facilities, and we really know where we fall. So you just have to be scrappy. You have to be diligent in learning and keeping up, and that's the best advice I have for you right now. If you run into problems where you think someone is not putting you in the correct category, you're going to need to let us know that on an individual basis, because for the most part, that's not what we're hearing across the system. So if you run into something where you can't find anybody or no one thinks you qualify, let us know, and we'll try to work with those providers or find you a different provider that does not believe that. So, but again, I cannot express enough how fluid the vaccine situation is. So please just bear with us and know we're going to try to get you as much information as possible. Okay, I think that covers that topic, and I'm going to turn it over to Kim right now because she wanted to kind of finish up on vaccines.
Thanks, Val. So I did plug in just now in the chat for everyone. We do have a designated mailbox. If you have any questions where we review those through central office, we're developing an FAQ. We're going to take the questions from the chat today, so please keep the questions coming. They're very important, and we'll do our best efforts to get responses out to you. Just really quickly, we're following the same process, somewhat similar to what we did with the testing efforts. From the feedback we received, that seemed to work pretty well. So thank you to all of the approximately 116 agencies as of yesterday that took time to respond to our survey on your vaccine needs for your direct support care staff. We had a really good response on that. you can still continue to do so. Those letters went out through provider relations, and we also sent a courtesy letter to those agencies that are on the call that are residential providers to your RNs. We also provided just some of the information we were covering today. With that being said, the intent of that survey is now that we have you established as an agency contact, we have your contact person's name, we have their information. As soon as we get the information from the state regarding specific contact information for those approved vaccinators that Val just mentioned, what we're going to do is individually communicate back to you and your agency with who in your respective counties of where you're needing those vaccinations to occur, we can link you with. And so then it's going to be up to you, though, to reach out to those vaccinators, right? And to communicate with them to try to work out the logistics of how you're going to get your teams vaccinated. With that being said, right now, until you receive that notification from us and that additional information, you can do the frontline efforts that Val was mentioning. If you have a direct relationship with a pharmacy that is an approved vaccinator and you know that, please work with them on your plan right now. Don't wait for us to send the information. One of the other efforts that we're going to do is once we get that final listing of the vaccinators and their contact information, we are also going to be compiling the information that we received from all of you in that survey and sending it back to our state pharmacy contact, so that then those vaccinators understand when you reach out to them and contact them that you are truly a 1A prioritization, categorization need. So a lot of efforts going on to support you in those areas. Again, just keep the questions coming. We'll do our best efforts to support you guys. As Val mentioned, things are changing constantly on an ongoing basis. And so I think that's all I have, Val, on that front.
Okay, thanks, Tim. And I did want to follow up on the question in the chat. I tried to type it in, but sometimes I think I talk better than I try to relay by typing. This is on the cost of the vaccination. So there's over 200 million doses of the vaccination that have already been paid for by the federal government. So the actual vaccination should not cost anybody anything. The administration of the vaccination, that person that fills out the paperwork, touches it in your arm, that will have a cost. Now, Medicare, Medicaid, private insurance, all of that should be covered through that path. If someone's uninsured, there's a mechanism for pharmacies to go back to HRSA, Health Resources Services Administration. I think that's right. Angie nodded her head. And they can get reimbursed for the uninsured. With that said, I feel like this could also look a lot like testing. And again, we're just not going to know until we're in there. But, you know, the labs all had the ability to charge insurance for COVID tests. None of them did it. It wasn't worth the effort for the volume of tests that they were doing if they could get reimbursement from somewhere else. So the vaccine itself is covered. No one should be paying for that, especially in 1A and 1B levels of coverage. But after that, I'm not sure. But I will tell you the vaccine and the administration is covered by Medicare and Medicaid. Private insurance should be covering it. It's just, it's going to be up to the vaccine administrator if they are going to go through the process to get it paid for that way. So I would not be surprised if some of them aren't, and that's something you should be paying attention to if you're a provider. Okay, I think, is there anything else in there before we go on? There was another question about for small providers, who would we contact to help us partner with a vaccinator? I know Kim is working on that. We're hoping before the middle of January to have a list of vaccinators in the state available for you all that can help facilitate if you've just not been able to find someone to do vaccinations for you that will help facilitate that. I'm fortunate to be able to work with Children's Division, Division of Youth Services, and see their correspondences with their pharmacies and talk to a lot of you guys about this. And I am hearing, you know, their pharmacies are being very straightforward with them. Either they think they're going to be able to help them or they tell them I'm not going to be able to help them. So really it just starts with having those conversations. And you just, like I say, that I've said this since the beginning of COVID, man, you got to be scrappy. And you know, you guys are always scrappy whenever you support both your staff and the individuals that we serve, and now you guys keep being scrappy. So, Okay, I think we're going to go on to Amber. So I'm going to turn it over to Amber to talk a little bit about investigations.
Thanks, Val. Like Val said, my name is Amber Daugherty. I am the director of the department's investigations unit. So my team is responsible for completing investigations into allegations of abuse and neglect when the alleged perpetrator is a staff member of either the state-operated facility or a contracted agency. So like everyone kind of on this call, we've also had to adapt our internal procedures in consideration of COVID. So happy to say over the last 8 months, we haven't at any point stopped accepting or completing investigations, but of course we have had to change our operating procedures, and we have several times over the last 8 months as we learn a little bit more about COVID and kind of how to minimize our risk. And we were able to kind of drill down into our procedures and see what part of our field work still needed to be completed in person at your agencies and what we could kind of do remotely. So what I thought I'd do today with my time is kind of tell you about 3 main points. So first, I want to tell you what you can expect at your agency under these temporary procedures if an investigation is opened at your agency. Second, I want to kind of tell you what we can do to help each other through this process, so to make this as quick and painless as possible as we're working an investigation under these kind of temporary procedures. And then 3, I want to tell you a little bit about our mitigation strategies that we're taking to ensure the safety of your staff and anyone else at your agency when we do have to complete in-person field work at your agency. So first, let's talk about expectations. So what can you expect if an investigation is opened at your agency under these temporary procedures? The first thing that you're going to notice that's a little bit different is going to be our document collection and evidence review. So historically, the investigations unit would come out to your agency and they would collect all of this information on their own. They'd make their own copies and take everything back to their office to complete their investigation. We have backed away from that under our temporary procedures. So we're currently collecting all of our documentation, audio evidence, video evidence remotely, so through electronic means by the help of an administrator at your agency. So we're using encrypted email, fax, a file share program, and kind of getting all of that through electronic means. The second thing that's going to look a little bit different during this time are our interviews. So historically, the investigations unit would conduct 99.9% of our interviews in person, and now we're kind of using a hybrid approach. So we're doing some in-person interviews, we're doing some interviews through virtual web conferencing, and then we're also conducting some interviews over the telephone. So there's lots of variables that the investigator will look at, depending on the specific investigation, to determine what the interviews might look like with your particular agency. So the investigator is looking at the type of allegation. Are we looking at a misuse of funds investigation, or are we looking at a physical or sexual abuse allegation? We're also looking at the severity of the allegation. So is there some significant harm to the alleged victim or potential harm to the alleged victim? We're looking at who the interviewee is. So is an alleged perpetrator that maybe we need to have an in-person interview with, or is the interviewee just an indirect witness or expert witness that maybe a telephone interview would suffice? We're also looking at the need of the interviewee. So if we have an alleged victim who may have communication needs for us to do a web conference or do an in-person meeting, then we're doing that as well. Also, we're looking at requests of the interviewee. We have had requests by witnesses and alleged victims that the investigator actually come and conduct the interview in person. So as you can see, there's just lots of different variables that we're taking into consideration when determining whether or not it's appropriate to do in-person field work versus maybe remote or over the telephone interviewing. So we're always constantly weighing the investigative value versus potential risk of exposure. The third thing that looks a little bit different with our investigations right now is the identification and collection of any COVID-related evidence. So certainly we understand that some of the events that we're looking at and some of the investigations, COVID could potentially play a role in that investigation. So the investigators are not turning a blind eye to that. Our objective is always to collect whatever information would be relevant to that particular event or investigation. So collecting and considering COVID-related information for us to pass on to the division is now kind of became part of that overall investigative procedure. So those are kind of the three different things that you would think of as maybe a little bit different under our temporary procedures, but everything else is the same. So we're still looking at the same types of allegations. We're still meeting our statutory deadlines and timelines. And to an untrained eye, our investigative report really looks just the same as it did pre-COVID. So really, overall process is still the same as it was prior to COVID. So the second thing I want to talk to you about today is what are some things that we can do to kind of help each other through this process. So we certainly understand that as a provider, you have a vested interest in making sure that an investigation goes as quick as possible and it's as painless as possible. So what are some things that we can do to kind of help each other out during that process? The first thing is making sure that you have a dedicated central agency contact for the investigations unit. So even now, or especially now, that we are trying to collect documentation and evidence remotely, we really need to have a responsive person at your agency that's responsible for contacting the investigator with that information. I would also recommend having a backup person. So we understand that some of you are working with skeleton crews, you may be working remotely, you may be providing some sort of direct care service. So having a backup person to work with the investigator is also probably a good idea. Along those same lines, whoever your designated individual is at your agency to work with the investigator, they need to make sure that they have the ability and knowledge to send that information in an electronic form. So make sure they have access to a scanner or a fax machine. Make sure they understand how to send encrypted emails. Do they know how to save audio and video to get that to the investigator? We understand there are definitely technical challenges with doing kind of some of this collection remotely, but if you are experiencing issues, I would encourage you to reach out to your investigator. They've been doing this now for 8 months. They're very creative, and as far as I know, there hasn't been an issue that we haven't been able to solve as far as getting the information that we need from your agency. So if you're having difficulties with that, please reach out to your investigator, and we can problem solve on how we can get the documents and evidence that we need to work our investigation. The third thing that we need to keep in mind is the investigators still need to have interview space at your agency. So just like pre-COVID, investigators have the ability and need to conduct some in-person interviews, and they need to do that at your agency. So kind of think through that. If your agency is involved in an investigation, where is that interview going to occur? If there are precautions that you would like the investigator to take to help minimize risk, please communicate those to the investigator. You know, we have agencies that, you know, anywhere from washing your hands, hand sanitizing when you get there, using a side door or back door so you're not walking through the main administration area, coming at a certain time so that we're not in contact with a lot of your agency staff. Any sort of those precautions that you would like to put in place, certainly communicate those to the investigator, but know that we still need to have some interview space to be able to complete our investigation. The next thing that I would encourage is making sure that your agency staff are wearing masks when the investigator presents at your agency to do any in-person field work. So an investigator is going to have a mask on before they come to your agency, during the course of their in-person field work, during their interviews, and all the way until they leave your agency. So it gives the investigators a lot of anxiety when they present to do some in-person field work and agency staff are not wearing masks. So please make sure that you're asking your staff to do that and enforcing that when an investigator would have to present to your agency. And then lastly, just asking for open communication. So if you have a staff member that's involved in an investigation or relevant for an event that may be under quarantine or medical isolation, or feeling sick that day, called in sick, then please make sure you're communicating that to your investigator so that they can plan their field work accordingly and can make whatever changes they need to as far as their kind of investigative plan with that particular individual. So there's just some things that we've kind of identified over the last couple of months that would really help our process along and make sure that we're getting our investigations turned around as quick as possible for you and making sure that we're able to stay within our time frames that we've set. And lastly, I just want to talk a little bit about our precautions and our mitigation strategies that our investigators are taking to ensure your safety, your staff safety, and of course the safety of our investigators as they're working out in the field. I know back in March and April there was a lot of anxiety and fear with investigators coming to your agencies and kind of moving around. And so I'm hopeful that in sharing what we're doing to help mitigate risk, that you will feel a little bit more comfortable the next time an investigator may have to come to your agency and do any sort of in-person field work. So all of our investigators are going through an 8-week testing rotation. And in between those 8 weeks, there may be even additional testing on top of that. So an investigator may be subject to a rapid test if they presented a state-operated facilities to conduct an investigation. If they're identified as a close contact, the investigator is asked to take an additional test before completing field work. Or if they just have a reasonable request for a test because they've been placed in a situation where they feel that would be necessary before they would complete their field work, then we're offering that to our investigators as well. So testing, of course, is a huge part of our mitigation strategy. PPE, the investigators have all been provided with what we feel is the appropriate PPE for them to move around safely in the community and in the field. So they have surgical face masks, cloth face coverings, gloves, hand sanitizer, Clorox disinfectant wipes to disinfect interview spaces, and have all been educated on social distancing, how to set up the interview room to prevent exposure, and all of those sort of things that they're keeping in mind as they're working in the field at your agency. Next, the investigators are all completing a self-assessment. So they are checking for temperatures, going through signs and symptoms of illness before they would go out into the field. They're also doing pre-interview questionnaires. So before they would ever bring anyone into interview at your agency, they are asking that interviewee all those signs and symptoms. Are they under quarantine, medical isolation? Are they sick today? Any reason why they don't feel that an in-person interview should they move forward with an in-person interview on the day of the interview? They're asking the interview all of those questions. Contact tracing logs. We're keeping a log of everyone that we come into contact with at your agency. So if we have to turn around and notify anyone that we think may be a close contact during work of our field, during our work in the field, then we have that contact information and would contact you back so that you can take the proper steps at that time. We're following all CDC recommendations as far as quarantine and medical isolation. Investigators are not working in the field or would present at your agency if they would be under any sort of quarantine restrictions. And then lastly, we're just really keeping on top of all of the COVID data that we can use. So we're looking at community transmission. We're looking at possible outbreaks at your facilities or agencies, and just trying to make really educated decisions on when we think in-person field work is appropriate and how we can kind of mitigate risk to everyone that's involved. So those were kind of the three things I want to talk about: expectations. I wanted to tell you about how to help each other, and then also our precautions. So hopefully you feel a little better about the investigators kind of moving around at your agencies. And then last, before I move it over back to the division, I just want to plug event reporting for just a minute. Please keep in mind that we're still doing investigations. Nothing has changed with your event reporting obligations. We rely so heavily on self-reporting. It is critical that you're keeping an eye on that and making sure that events are being reported as required by the division. So I appreciate all of your cooperation on that. I know you have a lot on your plate, but just something so critical that we really just don't want to fall through the cracks. And that's it for me. Val, I'm going to hand it back over to you.
Thank you, Amber. Right in mid-drink, but that's good. I'm going to move it over to Leslie now. Leslie's got some update on what's going on in waiver world. So, Leslie.
Thanks, Val. The division submitted informal requests for additional information known as IRAI to CMS for the Factor C waiver amendment, and we've moved to IRAI for removal of PCSC and counseling waiver amendments as well. The Comp and Community Support renewal applications and the Partnership for Hope and MOCID amendments to align with those renewals went out for formal public comment on 12/11, and Mo Health Net will accept written public comments until the end of business day on January 11, 2021. The division sent out an email blast last week with that link, so that's there for you to access. And that's all I have, Val.
All right, thank you, Leslie. Angie didn't really have any updates today. I know Wendy, I'm going to go to you next. I did want to address, partly because this is how we talk to each other too. There were a lot of questions that came in, but we've been on for a while today, and I do want to address a few more questions in the chat. So any questions that got submitted early, we will likely just go ahead and answer those in the FAQ or in the FAQ that follows this, because I want to be mindful of everyone's time. So Wendy, you're next.
Hi, good morning, everybody. And I just wanted to take a few minutes to say thank you, and we appreciate all the work that everybody is doing. And we know that everyone is so overwhelmed with dealing with COVID, however that impacts you in your line of work and in your professional or your personal life. But also want to just put out a reminder that this is an extremely difficult time for providers as they continue to wrestle with their staff shortages. They have staff that get sick themselves with COVID, that they have family members that get sick that they have to step out and take care of, and they have kids that aren't in school. And so all of those things are really piling on and are complicating an already very serious and critical issue for our providers. So just a reminder that everyone's first goal is to keep people safe and healthy. And we're just asking that individuals and the families and public administrators and guardians and support coordinators are all working in partnership with the providers when the providers are needing to look to alternative solutions to help with staffing arrangements like combining homes or just looking for some alternatives there. So please work in partnership with your providers to help them find solutions to the challenges that they're facing. So thank you so much. And Val, that's all I have. I'm going to let you go back to your questions.
All right, thank you, Wendy, and I echo all of her sentiments. I mean, we know just living as a provider through this right now too, and it's not, we don't get weeks to plan for these kind of things. We get someone walks in the door and they screen out, so we get minutes to plan. So it is really, really challenging. There was a question in the chat early on about telehealth and if we were going to allow it, extend it past the January deadline. Everything we're hearing on telehealth is really, really positive right now. What we're trying to do is, so we know that there's lots of ability to approve a lot of stuff we want to do with telehealth. It's just how do we fill out that paperwork to get it done? So my short answer to that question is yes. The plan is that we'll be able to continue to, and Angie hasn't thrown a ball at me yet, so I think she agrees. The short answer is yes. I think we should be able to continue to do a lot of that stuff. We just have to figure out the mechanism to which we continue to do that. And a lot of stuff is we're going to know at the end of January. And I know everybody wants more days to know those kind of things, but that's not the case. We're going to know at the end of January. Speaking of telehealth, we are definitely continuing Station MD, so please, no one thinks that's going away at the end of this month. It is not. So please continue to access Station MD. There's another question in the chat about will you be required as a state employee, and really this kind of applies to all employees, to get the vaccine when it becomes available to the general public. At this time, because the vaccine is emergency use authorization and because the FDA does not recommend that emergency use authorizations be mandated, it is not the intent that the vaccine will be mandated at this time. With that said, when the vaccine becomes available to the general public and you're a state employee, I don't know the answer to that. I don't think it's something we're interested in doing. But with that said, we do require the flu vaccine in some of our, within parts of DMH in order for you to go to work. So it may be that we follow that same protocol. If you don't get the vaccine, you have to wear a mask the whole time. You'll have to get tested regularly. I'm not sure what that's going to look like. It's, again, a very fluid situation. I'll tell you one of the questions we get a lot around this mandation of vaccines. So the EEOC, Equal Employment Opportunity Group, has said there is no law against mandating this vaccine, and we agree with that. There is no law that says you can't mandate a vaccine. However, scientific best practice for emergency use authorized vaccines like the COVID vaccine is not to mandate it. So that's kind of where we're at right now. Could you? Yes. Is it best practice? Probably not. Is it going to increase vaccination usage? Yes. Do we have enough vaccines for everybody right now? No. So there's lots of questions that play into all of that. But it's a very good question. I'm not saying that. It's just very, very fluid. There's some other questions in here that I know Kim's going to address directly around the vaccine with folks. So please, just because I don't address your questions, it doesn't mean we're not going to. One of the questions that we got was, if you've already got an agreement with a vaccinator, should you do the DMH survey? Well, you know me, I want your data. So the other reason I would suggest to do the DMH survey is, and this is kind of how I laid it out to Health and Senior Services earlier this week, because we're getting them lists of all of our providers, and we're working with the Pharmacy Association so that we can help try to facilitate these connections when we've got enough as we get more vaccine available in this state. And I said, my goal is to have vaccinators 7 deep to come in and vaccinate folks in my community setting. And the same is for my provider. I mean, I want it to be a popularity contest, and I want 7 people trying to get to a vaccination. So with that said, that would be the value of answering the survey on top of already having your vaccinator in place. There may be Walgreens may only get X amount, and we may be able to get something from a different pharmacy faster for you. That would be I don't know that that'll be the case or not. Remember how fluid this is. But there's benefits to getting more than one way to answer this question for you as a provider. There was another question about a provider that had reached out to a CVS pharmacy, and they'd asked if you were registered through the CDC. So early on, that's that federal, which was on that sheet we showed you earlier, and we kind of showed folks how in a call, I think in November, how to sign up for the Federal Pharmacy Partnership for Long-Term Care Program. So when they ask that question, that's why they're asking you that. They want to know if you've signed up for that Federal Pharmacy Partnership Program. Now, the sign up for that is over. That's not actually available anymore. If it gets reopened, we will let you know, but there's also a link to that on this website. They're probably asking you that question because they need to know what allotment so they're going to get allotment for the Federal Pharmacy Partnership Program. They may get another allotment from the state just as a vaccinator. They're going to need to know what allotment to get your vaccine out of. So that's why they're asking those kind of questions, okay? I think, like I said, I'm going to let Kim's going to address these specifically with folks. We have them all. We download them. We will go through them. Again, thank you all for what you do. Please stay safe. The next 2 weeks are going to be hard for a lot of folks. People want to see people want to touch people want to talk to people face to face, and we're getting there. It was a historic week in Missouri, in the country this week, because we've got vaccination in arms. But like we've told you over and over on this call, the vaccination's one component. You still got to wear the mask. We've still got to social distance until we get the reproductive rate of this virus down low enough where you don't have community transmission, where you don't have to worry every time you go out about contracting it. So the vaccine is huge in helping us get all of that under control, but it's one piece of the big puzzle. And really, at the end of the day, it's getting those community transmission levels down. It's getting the reproductive rate of the virus down, and that's what we still have to be working on. So thank you very much for all you continue to do. It's not getting easier. It gets harder because now you have to test, you have to screen your employees, and you've got to figure out how to get them vaccinated, and the same for the individuals that we support. But Appreciate everything you do. Have a happy holiday season, and we'll see you next year if we don't see you earlier. Thanks, everybody. Bye.